Welcome to another edition of the Effective Living Series. This is your 2022 Springboard, and we are on the radio on City Breakfast Show and also on television on the Breakfast Daily. My name is Bernard Avle. This week we're talking about family, rebuilding your family, and we are dealing with the 3 F's: finance, fertility, and food. Today we're talking fertility. My guest is a consultant at Shape Healthcare, who are specialized medical people for all your ups and Ghana. He's the main man there. Also a teacher at the University of Ghana Medical School. He's a fellow of the Ghana College of Physicians and Surgeons, and also is a consultant at Kolebu Teaching Hospital. Dr Promise Sefogah. Doc, thanks for joining us.
Thank you, Bernard, for having me.
When we say infertility, what are we talking about?
Yes, so infertility basically refers to the inability of a couple to have a baby after they have had regular unprotected sexual contact for 12 months. So that if the couple has been together for up to 6 months and there's no pregnancy yet, we say there's subfertility. Just so it brings enough attention for us to trigger some process of trying to investigate, particularly if the woman in that couple is 35 years or more or around. And it can either be a primary problem or a secondary problem. We say primary infertility if the woman has never been pregnant before. Secondary means that she has been pregnant before, irrespective of the outcome of the pregnancy. So for the pregnancy to happen, the woman has to release her egg from the ovary. The egg needs to travel through the tube. That is what we call ovulation. And if around that time she has unprotected sexual intercourse, the sperm is released here. The sperm has to be in a good number and have the ability to swim up to go meet up with the egg to fertilize it. The fertilized egg we call embryo would then have to travel down, settle inside here called implantation, and then it develops into a baby. So if that has not happened after 12 months, could it be a problem with an ovulation? Could it be a tubal factor problem? Could it be a problem with the uterus itself, commonly uterine fibroids? Or could it be a problem with the sperms on the part of the man?
So that's a basic introduction to what could the problem
could be. Yeah.
Amazing. So you are saying there are multiple reasons why the conception may not take place.
Yes.
You've spoken about the release of eggs,
yes,
the movement within the fallopian tube,
right,
issues within the uterus.
Yes.
What about the man himself? What if the thing he releases doesn't move?
That is also very important. And Bernard, you would be amazed to know that in our environment, problems with the tube contribute about 6 out of 10.
Okay.
60% of women who are not able to conceive, in the presence of everything else being okay, is related to tubal factor.
Okay.
The tubes get blocked. So typically this would have been a woman who may have been pregnant before at some point in life. So infertility is described as primary or secondary.
Okay.
So it is primary if the woman has never been pregnant before. Secondary, the woman has been pregnant before, irrespective of the outcome or where the pregnancy was located. So it could have been an ectopic, she could have had a miscarriage, she could have had a death of the baby inside. Once she's been pregnant before and now it's not happening, that is secondary. And a large majority of those secondary ones have to do with some infection that the woman may not have even known about,
in the tube,
which damaged the tube.
I see.
Right. Then the issue is with the men. So if you categorize the causes of infertility, 3 out of 10 is exclusively men related.
Wow. Exclusively men related.
Yes.
This is a revelation.
And another 3 out of 10 is exclusively women.
Okay.
3 out of 10 is from both parties.
Amazing.
And there's a 10% that we are yet to explain.
I'll leave that one to God.
Exactly.
3 out of 10 man exclusive, 3 out of 10 woman exclusive, 3 out of 10 either or both.
Both.
And then 1 out of 10 unexplained.
Yes. So 10% is unexplained.
And this is for our area, Ghana.
It's largely, globally.
It works as well.
Yes. But then when it goes down into the details, in our environment, we are seeing about half of the cases mainly from the man's side.
Really?
But interestingly,
about half of the cases,
yes,
are from the man.
Yes.
In this country,
in this part of the world.
But that's not what we hear when we watch TV.
That's not what we portray. Exactly. That's what we portray. And so society shifts so much of the burden onto the woman. in-laws, church members, everybody's at a woman's neck. And some research we did recently just to assess how much of the psychological impact this is having. 2 years or so ago, we woke up to the news of a couple in the central region who poisoned themselves to death because they have been unable to conceive.
Wow.
Yeah.
Is that serious?
Is that serious? It has been proven that through research that the level of depression that couples, particularly women who are having infertility, go through is comparable to what people go through when they have terminal cancer.
Are you serious?
Yes. Somebody has terminal cancer. We have come to do all the discussion. We said it looks like the cancer has spread, so it's going to take you down. So
they lose hope.
In that state, the kind of depression they feel
is similar to depression. Wow.
To the level of depression in infertility, largely because, you see, in our society, we are largely pronatal. We value family, we value children for various reasons, including we see children as a form of social insurance, so that in old age they take care of you. But we just fail to realize that it is not just an issue of the woman.
Wow. So you've said 3 out of 10 is women, 3 out of 10 men, 3 out of 10 boys. Talk a bit about the men. What could be wrong with a man to make the couple infertile?
So, the men produce the sperm. So during sexual intimacy, what comes out, we refer to it as seminal fluid. Okay. So that fluid contains the living things we call the sperm, which they also call tadpoles. So it is expected that fluid, 1 ml, a drop of that fluid should contain a particular number. So we use as a standard globally up to 20 million sperms.
20 million sperms?
In a drop, in a meal.
Oh, the men are powerful. In 1 meal?
In 1 meal.
Forgive.
Okay. Which is why when they are released, the fittest is the one that's able to reach the egg.
So the fittest of the 20 million?
The fittest of the 20
so
million.
So you just need one?
Just one.
That means one man can impregnate the whole world. Mr. Ayin, are you listening?
So hypothetically, yes. But not all of them are normal.
Okay.
Because after looking at the numbers, then we also look at their level of activity.
Okay.
They need to swim in a particular way to make us happy. So at least 50% should be able to swim in a straight line. They are
to
the
get
top
to their
grade.
destination where the egg is.
Right. Some are just making sluggish movement, side, like it says.
You're able to measure all that?
Yes, you assess all of that.
So it's not just the number of sperms within the fluid, but their strength and movement.
The movement pattern. We call it the motility.
They have to move straight.
Yes, that's desirable. If we're able to get 50% of them doing that, we are not bad. So
when you say sperm count, what are you talking about?
Yes, so the sperm count is a report of all these parameters.
Oh.
How does it look like? How soon does it liquefy? It's a little thick. It's supposed to melt after a certain number of minutes. How well is that happening? What's the acid level? You are a scientist, originally a scientist.
Supposed to be.
So what's the pH? Is there any evidence of
alkaline? Wow.
Is there any evidence of infections, any of blood cells, any abnormal cells? How many of them have 2 heads or no tail or long? Those abnormalities, we assess all of that.
Wow.
Okay, as a measure of the man's fertility potential.
So these days, when people come to your facilities for infertility, let's assume they have a year, 2 years, no child, what investigations do you do?
Now you're sounding almost like a doctor.
Now you are teaching me, so you're a teacher, so I'm following the lectures.
That is true. So we investigate a couple.
Okay.
We always encourage that. Let's see them as a couple.
Okay.
Because, typically the women are receiving the brunt of it. They come and you explain everything. If I tell you, the woman, that it could also be a sperm factor, it will be some relief to you. But there's no way this woman who feels less empowered can go tell that to the husband who already sided with the in-laws to know that my wife is the problem. So if they come as a couple and we explain, it gives us a good footing. And then we request, let's check the woman's ovarian function through blood test.
Good.
Let's assess if the tubes are okay or if they are blocked. Let's do an ultrasound scan to see if there are any fibroids or any abnormalities. Let's do the seminal fluid analysis.
Okay.
So we do all that. The results are in together.
So it's a joint report.
That is better. Okay, so together, yes, you are welcome, Mr. and Mrs. Today we've got the results. The woman's part, this level of the hormone is okay. This is a little abnormal. We can use medications to correct. The tube is okay, blah, blah, blah. Then Mr. U, the sperm count is just about 3.5 million instead of 20 million. And instead of 50% moving in a straight line, we have only 1%. So there's a problem. Then the man now settles.
Understands that this is possibly the job.
This is possible, my game. And then it makes them cooperate better.
So if only one person comes, it makes it difficult to give them a holistic picture.
Yes.
So you may be checking the woman, making all the information, but there's one critical factor that's absent.
Which is missing. Because sometimes you even give the request to the missus, give it to Mr. to do this lab, and you bring the report the next time. They wouldn't.
The man won't do it. There's nothing wrong with me.
Exactly.
I'm okay.
That mentality. Okay, so dear men, it works better when you join forces with your wife and seek care together.
So we are still talking effective living. This morning we're talking about the third F, fertility. We've spoken about finance, spoken about food. My guest is Dr. Promise Sefogah, teaches at the medical school. He's also a consultant at Kolebu, and is also at the SHIP Healthcare, which is a specialist medical center. Just give me fertility 101 with a quick thing he took me through. So what are the possible remedies and treatments? Because we've already spoken about sub-infertility and main. So if it's below 6 months, there's also spoken about primary and secondary, right? So let's use the worst case scenario.
Right.
This is 2 years, 3 years, never been pregnant. Either and never been pregnant on either side. Man has not impregnated anybody. Woman has not been impregnated by anybody. What are the possible solutions?
Right. So in a nutshell, the specific solution for a specific couple depends on the specific cause.
I get it.
Right. Okay. So if it's a problem of defective ovulation, just medications will solve that.
Okay.
Okay. Give you medication that you start on a particular day of your menstrual cycle, and then give you a number of days to have sexual intercourse. The next month, you call in that you're pregnant.
So there are medications that can help with ovulation?
Yes. If the problem is with absence of ovulation.
Good.
If it has to do with the tube, some of it we're able to flush them open.
Okay.
Right. Some may require surgery to recanalize. Some are beyond repairs, so we have to perform that fertilization process in the laboratory, what we call in vitro fertilization.
You take the egg, you take the sperm, put it in a test tube, and then inject it into the...
You're saying it's so raw. Put in a test tube and inject it into there. So we take out the egg.
Take out the egg from the woman.
From the woman.
So the woman's
The woman would have gone through about 12, 14 days of daily injections. So that instead of naturally getting just one egg, we have a multiple. We can have 10, 12, 13, 14, 20 eggs. Then when the eggs are mature and we remove them, we get a sperm from the man. If the sperms are so bad, then we have to look under the mic and pick the
one
perfect ones
that is moving straight.
So pick them and then inject directly into the egg to fertilize.
You are helping the process.
Right.
It's still a natural process.
Yes. Okay, so that is what we call having to inject the sperm into the egg. Now is another higher form of the IVF we call intracytoplasmic sperm injection, ICSI. Okay. So we have formed the embryos or the pregnancy. So we grow them in the specialized laboratory for about 3 to 5 days. Because out of all the 20 that we have fertilized, not all will be genetically okay. The best would survive 3 to 5 days. Then we go and take 2 or 3, depending on the woman's age, and put back in the uterus. Which is why we do that, because if you just put in one and it does not implant, it's not 100% guaranteed, then, and it's expensive. So you put in 2 or 3, just so
the strongest
one
will survive.
does not exactly. Which is why that treatment tends to give more twins and triplets.
I see. So that seems pretty complex and it's quite expensive as well.
But practically not as complex as it sounds.
Okay.
Yeah, it's a simple treatment course.
So that's the so-called test tube baby.
Yes,
that's the so-called test tube.
You know that the use of test tube sounds
that's not right.
Yes.
So it's called in vitro fertilization.
In
vitro fertilization.
Okay. Good. Other times, like we mentioned, the problem may be with fibroids. So then the simplest is surgical removal of the fibroids, what we call myomectomy.
What is a fibroid?
So the fibroids are abnormal growths that affect the womb. Okay, the womb is there, made up of muscle. So some of these muscle cells just begin to multiply out of control.
Okay.
So they multiply, they form a lump in various parts of the womb, particularly in black women and women of Southeastern Asian racial background. Yeah. Okay. So that is it. And it's a big problem here. A large majority of women, if you take 10 women now, chances are that 7 out of 10 have fibroids.
Has this always been the case, or is more recent?
It probably has always been, but there hasn't been a lot of advances in detecting them.
I see.
Like we do.
Because
now.
I've heard some of your colleagues say that the inordinate occurrence of fibroids among black women obviously has some unexplained causes.
Yes.
Some of which they believe is even some of the chemicals they use and things.
Yeah, we actually also think some of the exposure to the sun, so many
There are possible
theories. Yes. But the problem is it is quite rampant here, but a lot of it is asymptomatic.
Okay.
So somebody would have lived their whole life, died. When we are doing post-mortem, examining organ by organ, we say, oh, she even had fibroids.
But it didn't affect anything?
No.
Okay.
Okay, But in some cases, and of course the problems that would let the woman come for us to investigate and see fibroid, maybe difficulty conceiving or abnormal menstrual bleeding.
Or painful.
Or painful. They'll bleed very heavily with clots. Or you have your period, you're expecting the next one, you're bleeding in between.
So the fibroids could be the cause?
They could be the cause. Of course, there could also be a problem with the cervical.
So if it's fibroid causing infertility, what do? You remove it?
Remove the fibroids through surgery. We call it myomectomy.
Okay.
So depending on the size of the fibroid, either we do an open surgery, cut through the lower abdomen, of course under anesthesia, go in, remove all of them, and repair the uterus back. Give it about 3 to 4 months to heal, tight enough to be able to carry pregnancy and expand, you know. Or there's a keyhole one we do called laparoscopic. If it's not so big, just put a few probes here, and then we are looking on the screen and we are doing the surgery as though you're playing a video game.
And then you pick the serious one. So you're saying fibroids, depending on where they are and how serious they are, could affect pregnancy, but a lot of it can be there and you can still be pregnant.
Yes, and not a lot of it. There are people who have fibroids are able to get pregnant. Even when you came to us with inability to conceive and we find fibroids, it doesn't mean straight away remove the fibroid. Let's find out if the fibroid's location is a potential cause of the infertility or not. If the location is likely not related, we leave them there, go ahead with the treatment, and then the woman gets pregnant, carries the pregnancy, coexisting with the fibroids, and then the doctor looking after the woman will decide if it is necessary to remove that fibroid, say at the time of delivery or later on, or not at all.
I see. So far, you've spoken about the artificial insemination and the fibroid.
Yes.
Are there more complex treatments? What other possibilities exist?
So the other possibilities are less complex than the highest is the ICSI, that's a form of the in vitro fertilization where we have to inject the sperm directly into the egg. There's another condition we call polycystic ovarian syndrome.
Okay.
Where the ovaries, instead of looking that nice, like I showed earlier, have small cysts inside. These ovaries...
What is a cyst?
A cyst, like, imagine as a tiny balloon with fluid.
Okay.
In the ovary. Okay. Now, the woman is supposed to have tiny, now one of them becomes big enough to release the egg.
Ooh.
But in this condition, there are so many of them, and they are all there. None really gets to mature to release the egg. So this woman is unable to ovulate in about 60% of cases. Okay, and so that may require some surgical intervention or medication.
Okay.
So if a woman has this problem, they tend to be very hairy because this ovary looking like this tends to produce a lot more of male hormone called testosterone. So they like to be hairy. They have beard. They have hairy chest, hair on the tummy, hairy legs. Tend to be a little on the bigger side. Then have a lot of acne. So if a woman has those features,
it's a clue to what possibly could be happening.
Which is in a way of pregnancy happening.
Wow.
You know?
It's amazing how nature gives you clues.
Yes,
just based on what you study.
Yeah.
So you can observe, and then when you investigate, you find this. And you can. So what do you do with this one? Do you remove the cyst? What do you do?
Some will require medication. Some we may have to do some laparoscopic surgery to burn off some of the cysts.
Okay.
To retain the ovary to function.
Are all these things available in Ghana? These laparoscopic things you are mentioning?
Yes, they are, but not widely available.
So the first one you mentioned is available in Ghana?
Yes.
This laparos thing too is in Ghana?
Yes, laparoscopic ovarian drilling.
What if the man is firing blanks?
Yes.
Can you help them? What can you do for the man?
So we try to find what the reason could be. Mm-hmm. Is it like the man is being exposed to so much heat? Heat. You see that the Almighty Creator created human beings and put the testes outside the body.
Okay.
Because the testes need a temperature lower than that of the rest of the body to operate.
Okay.
So if for some reason you are working in a hot environment,
you are sitting in a trotro, you are
driving
a hot, you are sitting on the engine of a trotro every day. If you are
exactly.
So if you are a mate and you sit on the engine of a trotro every day,
or even a long distance driver,
you are boiling your things.
You know, and that is a common problem in that group of professionals.
Really?
Yes. So you just said something.
So if there's a lot of heat, it affects sperm production.
Sperm production. And so the count will be low, motility will be low, right?
Wow.
So the heat could be from your work environment, or when you wear a lot of tight underwear, that will push the thing to the rest of the body.
Wow.
Right? Or black underwears. You know, black absorbs heat.
Black underwear. My cameramen are taking notes.
They are taking notes, yes. Do you want to inspect after the show?
Kamaru, black underwear. Well, throw all the black underwear away.
You know.
Just get white ones.
Right. So that can be
and they must be cotton. Don't wear linen.
That's right.
I have a few cameramen I'm harassing
here. On show. Right. Or sometimes there is abnormal blood vessel around the test. You see how some of us have got big veins. Some of these around the testes is called varicocele. You know, the blood is warm, so it also affects the temperature there. Amazing. You know, or for some reason, the guy works in an area where he's exposed constantly to radiations.
Wow.
Yes. Even recently, we are talking about don't put your laptop on your lap, because there's some subtle things coming. You know,
we are challenging. The laptop can cause damage.
Yeah, I mean, this is something you do daily. We are concerned.
You should have told us earlier.
So we are starting at the beginning of the year.
So that they produce radiations. Radiations can interfere with.
Yes, it can affect the sperm production.
How long does it take to do these investigations? Because in the women and the men, you've just spoken about investigations. Is this something you do like in a week? Is it a year?
Yeah. I mean, most of our centers, our place of stop shop. You walk in, we're able to get these things done, and then we're able to formulate what is going to work for you. Particularly if the woman is already 35, there's also what we call age-related fertility decline.
Okay.
You see, a woman is born with a set number of eggs, pre-packed.
Okay.
It's about 450,000. So every month, a number of them begin to grow. Then one of them becomes the dominant one, gets released. The rest are wasted. Another month like that. So they are going. So from puberty, which is why the woman gets to a place where the eggs are finished, menopause. The menses stop, no more egg, no more natural reproductive function. So if the woman is around that age, we do IVF, but we have to use a younger person's egg. So if you are tall, you are a little light, you have a big head, we find somebody that will fit you, check the blood groups, of course, voluntary donor. You sign up that you want to donate your egg. You put it through the treatment. When your eggs are, we take the woman's husband's sperm, fertilizes eggs, and then the woman carries it. Which is why women who are menopausal are able to get them pregnant.
So the problem is that the egg being produced in this case. But once the fertilization is done, they can carry.
Yeah, they can carry
pregnancy.
Yeah, with a bit of support.
Wow, this is interesting.
Okay. In the same way, if the woman for some reason has problem with the uterus or has lost the uterus due to some other problem, we take, and the ovaries are there, we can take her eggs, fertilize the husband's sperm, get a third party to carry it for them. That's what we call surrogacy.
I get it.
Yeah. Or, in the case of the man, if we find that the problem is just behavioral, modify your lifestyle. If it is from the varicocele, some minor surgery to clip off those blood vessels. If for some reason the man has had cancer treatment, and that works for both of them. Cancer treatment, chemotherapy or radiation destroys the testes and the eggs and the ovaries. So there's what we call fertility preservation, which is the drive now.
Okay,
so that if for some reason this woman is going to go through cancer therapy, the cancer specialist will refer them to us. we stimulate them, harvest the eggs, and freeze.
Whilst the treatment goes
Then
on.
they go and go through the treatment, which is likely to blast the ovaries and everything. When it's all done, they have survived cancer.
You can then.
Now let's look at reproductive function.
Wow. These are medical miracles.
Yeah.
Amazing.
Yes. And of course, so either for the men or the women, we can also freeze the sperm. There, we freeze it there. Every year you pay something to keep it frozen.
And then when you are ready.
When you are ready, we thaw and we use. That's what we call fertility preservation.
What is the rate of success generally? That's a very broad question. So let's assume for every 10 people who come, 10 couples who come, an investigation is done. What percentage of them eventually get resolved?
Oh, so that's the fulfilling part of doing this. Once you are systematic, you go through, you find a problem, you solve it. Not so somebody, like I said, may just require medication, and the next cycle or two, they are pregnant. Their problem is solved. Another person, the sperm is okay, but the movement is weak. The woman is okay. You could just inject the sperm itself inside to go fertilize the egg. In about 4 out of 10, that works. Another one, you have to do the IVF, which is the highest success rate, ranging about, for our center, it's around 70-73%. It varies.
That's pretty high.
Yeah, it varies based on each center and their treatment protocols. Okay. So what I wanted to say about the woman's age is that, you see, we are having a lot of our women now in pursuit of career are delaying childbearing, which is legitimate, so that we can have women who are accomplished to manage. Hopefully one of them will manage the country for us one day. You know, women are better managers, I don't know. They manage the home. So if the woman, for some reason, thinks that, hey, I've crossed 35, there's no Mr. Right yet, I don't see myself getting pregnant soon, come. Let's stimulate you, harvest the eggs, and freeze them for you.
Wow. If
you finish all your MBA, KBC, whatever, at age 49, and you now want to start having babies, you have eggs that are 35 years old.
That you can then, when the money is available, you can
we
then
fertilize
and then inject back.
Yes.
That's amazing. So you do that at SHAPE
Yes.
Healthcare.
That's fertility preservation.
I like that. Dr. Promise Sefogah is the consultant obstetrician at SHAPE Healthcare. Also teaches at the University of Ghana Medical School, and he's also a consultant at Kolebu Teaching Hospital. We've been talking about fertility issues in relation to family as part of our second week of the Effective Living Series. Hope you've learned something new. Thank you for watching. Thank you for listening. My name is Bernard Avle. We'll see you next time with another edition. Bye-bye.